Are you starting Medicare soon and wondering which of the Medigap plans, also known as Medicare Supplements, makes the most sense for you? Not just now, but also in the years ahead. Today we're comparing the three most popular Medicare supplement options, Plan G, Plan N, and High Deductible Plan G. We'll look at the benefits, the costs, and most importantly, how these plans might fit your health and budget as you age. Hi, I'm Tabitha Moldenhauer. I've been an independent licensed insurance producer specializing in Medicare since 2005. My goal is to help my clients understand their Medicare options and find the coverage that best suits their needs. Let's start with the basics. Medigap plans are insurance policies that fill in the gaps that would otherwise be your out-of-pocket expenses in original Medicare Parts A and B. Medicare Parts A and B are your primary health insurance. If you have a covered medical expense, Medicare pays first, and your Medicare supplement pays second based on the plan benefits. There are no networks and no referrals with standard Medicare supplements. You can see any doctor and go to any hospital or facility in the country that accepts Medicare patients. And here's a bonus, your benefits won't change from year to year. Medigap plans are standardized by law, so once you choose one, you can count on it staying consistent. Let's take a closer look at the differences between Plan G, Plan N, and High Deductible Plan G. As you can see, the inpatient coverage is identical whether you have a Plan G or a Plan N. With either N or G, if you have a covered inpatient stay, all costs are shared between Medicare Part A and your Medicare Supplement. If you have High Deductible Plan G, you will pay the first $2,870 in Medicare Parts A and B deductibles, copays, and coinsurance charges. If you reach $2,870 in out-of-pocket spending in a calendar year, then the High Deductible Plan G kicks in and starts paying just like the standard Plan G. The only differences between the two more comprehensive plans, N and G, are in outpatient coverage. Let's take a closer look at those. Medicare Part B excess charges are covered by Plan G, but not Plan N. If you have High Deductible Plan G, you are responsible for excess charges until you reach your deductible. Excess charges are only allowed on Medicare Part B, which is outpatient coverage. It is not possible to have an excess charge on anything inpatient, whether that is in a hospital or a skilled nursing facility. Both of those fall under Medicare Part A. Whenever anyone talks about excess charges, just keep in mind that they can only occur with outpatient treatment. The only way you can be billed a Part B excess charge is if you see a non-participating provider. A non-participating provider accepts Medicare patients but does not accept Medicare payments as payment in full and has the right to balance bill patients up to 15% as an excess charge. Only about 2% of Medicare doctors contract as non-participating providers. Of that 2%, about 40% of those are in the mental health field. Unless you are receiving outpatient mental health treatment, it is highly unlikely that you will ever have a Medicare Part B excess charge. However, if you want to be absolutely sure before you see a new doctor, you can always check that doctor's contracting status at Medicare.gov using the Physician Compare tool. Years ago, excess charges were a much bigger risk than they are now. Facilities like Mayo Clinic used to be non-participating providers. So for any Medicare beneficiaries who wanted to have the ability to see those providers without paying excess charges, it was worth it to buy a Medigap plan that covered Part B excess charges. Now, even Mayo Clinic in all of its locations is a participating Medicare provider and does not charge excess charges. Also, 8 states have outlawed Medicare Part B excess charges. Those states are Connecticut, Vermont, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, and Rhode Island. So if you receive medical treatment in those states, you cannot be charged a Part B excess charge. And thanks to new legislation, ambulance companies, whether air or ground, cannot charge excess charges for emergency transportation. Now, there can still be billing issues with Medicare for ambulance transportation when it is not considered an emergency. And that is something that all Medicare beneficiaries need to be aware of. Since non-participating providers have to accept less money from Medicare to be able to charge their patients excess charges, most facilities and providers have decided it's in their financial best interest to take the higher fee schedule from Medicare as participating providers rather than try to balance bill their patients for those excess charges. Excess charges are very rare and they are not guaranteed even if you see a non-participating provider. The provider can decide whether to balance bill excess charges on a case-by-case basis, and the amount is not always 15%. The excess charge is limited at no more than 15%, but the non-participating provider could also choose to charge an excess charge that is less than 15%. The other difference between G and N is that with Plan N, after meeting your Medicare Part B deductible for the year, you may have copays for some office visits of up to $20 and emergency room visits for up to $50, although the emergency room visit copay is waived if you are admitted to the hospital. These office visit copays are not charged at every visit. It depends on how your visit is coded by your provider's office. So it isn't guaranteed with Plan N that you will have a copay at every office visit. If you do have a copay, that copay is capped at no more than $20. There is a link in the description to a document from Medicare that explains in more detail which office visits are subject to the $20 copay with Medicare Supplement Plan N. Visits for things like physical therapy, chemotherapy, and radiation have no copays with Medigap Plan N. The types of office visits that do result in Plan N copays are things like psychotherapy visits, ophthalmology visits, new patient evaluations, patient education, and visits for ongoing evaluation and diagnosis. With High Deductible Plan G, you do not have copays, but after you reach your Medicare Part B annual deductible, this year it is $257, you are responsible for 20% of all outpatient services until you reach $2,870 in out-of-pocket spending. In most parts of the country, Plan N has lower monthly premium costs than Plan G, and High Deductible Plan G has even lower costs than Plan N. Here are some actual premium cost differences between Plan G, Plan N, and High Deductible Plan G. I ran quotes for 70-year-old male and female Plan G, Plan N, and High Deductible Plan G policies in the state of Florida. For a 70-year-old male, a Plan G is about $250 a month. Plan N is $190 a month, and High Deductible Plan G is $85 per month. If this person wanted one of the two more comprehensive plans, G or N, the price difference every month for the premium is $60. $60 equals the copay for 3 office visits with Plan N. In this example, unless a person is making office visits that trigger a Plan N copay more than 3 times per month or finds himself in the ER at least once a month, he will be financially better off with a Plan N rather than paying the higher premium for that Plan G. If this person is pretty healthy and comfortable with the $2,870 deductible, he could, of course, save even more on the monthly premiums by going with High Deductible Plan G. For a woman in the same part of Florida, a Plan G at age 70 is $220 per month, Plan N is $170 per month, and High Deductible Plan G is $75 a month. Unless she is going to be making at least 2 office visits every month that are subject to Plan N copays, Plan N makes more sense financially between the two more comprehensive plans, G and N. And just like with the male pricing, if she is healthy and okay with the $2,870 deductible, she could potentially save even more with High Deductible Plan G. Medigap prices change generally once per year, whether you have any medical claims or not. And most of the time, the price goes up, not down. These increases are heavily based on the premiums paid into the company versus the money paid out in medical claims from the company for everyone in your state who owns that company's Medigap policies. Because it's based on the claims experience of that entire group, your own personal health has virtually no effect on your Medigap rate increases. Different companies use different pricing models: attained age, issue age, and community rated. At the end of the day, the pricing method doesn't make much long-term difference to the rate increases that are felt by each individual consumer. So far this year, Plan G rate increases have averaged between 12 and 20%. Plan N increases are around 10%. High Deductible Plan G rate increases are about 5%. Now, there are variations by zip code and by insurance company, and those can be very large. However, here's how the average rate increases will look for Medicare consumers over several years. Let's say someone enrolls in a Plan G at age 65 for $160 per month. If that has a 12% rate increase every year, it will be $282 per month at age 70 and $497 per month at age 75. If that person enrolled in a Plan N at age 65, the starting cost would be $120 per month. Assuming a 10% increase every year, that Plan N will be $193 per month at age 70 and $311 per month at age 75. With a high deductible Plan G, the cost at age 65 is $50 per month. Assuming 5% rate increases each year, that monthly premium would be $64 at age 70 and $82 at age 75. Please note, Medicare Supplement rate increases are not steady each year. There are some years when the increase may be 0% or there might even be a decrease. There are also some rate increases of 40% or more. The averages in these examples give you a rough idea of what you can expect if you purchase a Medigap plan at age 65 and keep it for many years. As you can see, if you want more comprehensive coverage with Plan G or Plan N, the difference between those two plans' premium costs grows every year. Unless someone is making many office visits that are subject to those Plan N copays, Plan N, with its generally lower rate increases, will save money over time versus a Plan G. High Deductible Plan G can save even more with the big assumption that you won't need much medical care. You do need to add the deductible cost of High Deductible Plan G to the premium cost to get an idea of what the worst case scenario would be if you do have years with high medical spending. High Deductible Plan G has the potential to be more expensive than either Plan G or Plan N if you do need a lot of medical care. Your choice of Medicare Supplement coverage is completely up to you. I can explain the benefits and the math, but each client in the end chooses whichever plan they are most comfortable with. That said, for someone with an expensive to treat chronic health condition that requires lots of diagnostic office visits, Plan G is the clear choice. For healthy people, it's really up to you. My goal is to make sure you have as much information as possible about what the future may hold when you are making this decision at age 64 or 65. If you are healthy and have a substantial balance built up in a health savings account, High Deductible Plan G can be a good option. You aren't allowed to pay for Medigap monthly premiums with HSA funds, but you can pay for deductibles, copays, and coinsurance from your HSA while you are on Medicare. For people who are in relatively good health, Plan N provides comprehensive coverage with generally lower rate increases over time than Plan G, and in most cases, few extra out-of-pocket costs. Plan G and Plan N are sold by virtually all Medicare Supplement companies. High Deductible Plan G is not. You may have limited options for insurance companies in your area if you want High Deductible Plan G. Here are some reasons why High Deductible Plan G, although it works well for some people, is the least popular of these three Medicare Supplement options. First, the deductible can be a barrier. If you don't have savings to cover the deductible in case of a serious medical condition, or potentially several bad years in a row with high spending toward that deductible, then this is not the right plan for you. Depending on where you live, you might not be able to change to a Plan G or a Plan N without having to go through medical questions and health underwriting in the future. So that deductible cost can be quite a large expense in future years if your health declines. Not many agents or brokers talk about High Deductible Plan G. Some don't even bother to sell High Deductible Plan G policies. Why? Because the commissions paid on High Deductible Plan G policies are quite low. We are paid a percentage of your initial premium as commission. It's usually a little over 20%. 20% of $160 or $120 is obviously a lot more than 20% of $50. Third, in some parts of the country, the Medicare Supplement High Deductible Plan G premium costs plus deductible are equal to or even more than the maximum out-of-pocket risk on some Medicare Advantage plans. When comparing all options, some people decide to go with a Medicare Advantage plan instead of High Deductible Plan G, since the out-of-pocket risk has the potential to be about the same, and the Medicare Advantage plans have extra benefits beyond what's included with Medicare supplements. Your insurance company won't pay anything toward your medical care unless you reach the deductible. You may have many years of owning a High Deductible Plan G without your insurance company ever paying a medical claim. This is how the plan is designed to work, but some people don't like owning insurance that doesn't pay for any of their medical care. Once you've decided on the Medicare supplement that has the right level of coverage for you, it's time to comparison shop all of the companies that offer that plan in your area. Although the coverage is standardized by law, the costs from company to company for the exact same plan can be very different. It is really important to do detailed comparison shopping and research before applying. It can save you a lot of money initially and in future years. Fortunately, you don't have to do that alone. This is what we do for all of our clients as Medicare plan brokers. We work with many insurance companies and can impartially comparison shop with you to find the plan and the company that's the best fit for your situation. We do this completely free of charge for our clients. We are able to do that because for each enrollment into a Medicare plan through our office, we are paid a commission by an insurance company. The commissions are very similar from one company to another, so we have no reason to push one particular plan or company for our own gain. We are free to find the plan and the company that best fits each client's medical and financial situation. And the Medicare supplement cost to you is the same whether you purchase through a Medicare plan broker or direct with an insurance company. Once you are a client of ours, you have free ongoing access to help whenever you have a question about your coverage or when premiums or plans change and you need to reevaluate and possibly change insurance policies. If you have Medicare supplement questions, please feel free to give the office a call at 877-312-1414 or reserve a free no obligation Medicare plan consultation using the link in the description. We're here to help you understand your options and find the right Medicare coverage for you. Have a great day.